My name is Jenny Lee Sims and I'm the lead nurse here in Bluestone. So we have been implementing the Safewards model over the last 18 months or so across all of our 7 wards. Each ward is at a different stage, but they are working so hard alongside our patients in implementing the different interventions. So we have seen a massive reduction in our number of incidents and our PRN usage for our patients following the use of CAM cards and tranquility tools, as well as recovery focused activities. And we really feel this had massive benefit to our patients and also to our staff, who are very proud of each of their wards, and I really feel it's had a positive impact on staff wellbeing, and we're just very proud of everyone involved.
Safewards is more than just an initiative. It was used in a randomised control trial where 10 Safewards interventions were practiced on 2 wards. One ward where they're practiced every day by all the staff, and one ward where they were just used sort of half about. So what we found in the results was that the ward where they practiced them every day and it was part of the community reduced a lot of conflict and containment. So conflict being like aggressive behaviours, self-harm, AWOL, and containment being the reduction of one-to-one OBS, PRN medication, seclusion. So what we done, it's worldwide, so it's in Australia, China, the whole of Europe, so all mental health wards are using it at the moment. Here on Clough we've used 6 of the 10 interventions, so it's working really well. It's just about creating really a sense of a community, so taking away that staff-patient barrier and creating this a community and a sense of everybody working together.
This is our TRN stand, which is a recent addition into the ward. It's probably now about 4 months. We have tea, coffee, herbal teas, fruit, milkshakes, healthy snacks, cereal bars and various things. We definitely find that this is a big improvement to the ward. It's reducing our levels of hostility and aggression. Patients can come, get a cup of tea, get a coffee as they need to, get a snack as they need to.
It has helped to reduce PRN and offers an intervention that is designed to reduce the risk of conflict on the ward.
We have implemented CAM cards for some of our patients. So the CAM cards consist of different strategies and different methods that we can calm our patients to de-escalate prior to using PRN medication. So it may consist of activities, it may consist of food, it may consist of exercise. As I say, everyone is totally individual to the actual patient.
Improve well, so we're trying to improve the experience for patients and for staff in our environment. So as you can see, we've put some information boards up, notice boards. We're looking at Improve Well app, which allows staff to give us their feedback and their ideas of what we can implement to make the environment better. And we have our TRN hatch as well, which is going really well for the patients. So they're just a few of the things that are making our job easier and the patients' environment much more positive here in PICU.
This is our new sensory room here in Dorsey, and it's a valuable space for our service users where they can come and enjoy lights and different sensory activities. We use it as a de-escalation strategy or just as a wee space where they can have time out. In terms of patient moods, it really has had a positive effect on their moods and just like enjoying activities with staff.
So the staff here in Bronte Ward decided to redesign our courtyard, and we looked at it being like a sensory project. So we looked at the plants that we could use, and we looked at the properties, and we used scented plants like lavender, rosemary, sage, thyme, and to make it like a nice relaxing area for our patients to go out and sit and enjoy the wonderful flowers and the colour schemes. And the plants we used also was to attract wildlife into the small communal garden, and it has been very beneficial for our patients, and we've had great feedback on it. And so that project we started last spring, we're continuing to work on that, and it's very much patient-led. So it's a great way of getting everybody involved in the gardening projects and in the gardening sessions.